Did you know that unexplained itching in certain spots on your body could be a silent warning from your body about cancer? It's easy to brush off a little itch here and there, but for older adults, especially those over 60, certain itches in very specific areas could signal something much more serious. Your body is trying to tell you something, and it's crucial that we listen. In this video, we're going to explore 5 specific itchy spots on your body that could indicate cancer. These aren't random or general itches. They're patterns that doctors have observed repeatedly in patients who were later diagnosed with conditions like lymphoma, pancreatic cancer, breast cancer, and more. Itching in these specific areas could be a clue that your body needs attention. Stick with me until the end, because we're not just going to list these body parts. We'll also dive into why these areas itch, what cancers they're linked to, and how to distinguish between harmless irritation and something that needs immediate medical attention. The earlier you notice these subtle signs, the better the chances of catching something before it gets harder to treat. The goal of this video is to raise awareness and help you recognize the hidden signs that could save your life. Your body is constantly communicating with you. Paying attention to these quiet, often ignored signals could be the difference between an early diagnosis and a much more difficult journey later on. This is about empowerment, not panic. Learning what to watch for, what questions to ask your doctor, and what actions to take if you notice these signs. Let's get started. Sign number 1, persistent itching on the lower legs. When older adults experience persistent itching on the lower legs, particularly the shins or calves, it's often dismissed as just dry skin or a minor irritation. However, this seemingly harmless itch could be trying to tell you something far more important. Specifically, it could indicate a blood-related cancer, such as lymphoma, which affects the lymphatic system, a crucial part of your body's immune defense network. Why this happens? As cancers like lymphoma grow, they release inflammatory chemicals into the bloodstream. These chemicals can irritate the nerves, especially in areas like the lower legs. Even if your skin looks perfectly normal on the surface, the nerves underneath may be reacting to the internal disturbance. The itch often worsens at night, which can make it even more difficult to ignore, and may not respond to common treatments like moisturizers or lotions. A study published in the Journal of the American Academy of Dermatology indicates that persistent itching, pruritus, in cancer patients, particularly those with lymphoma, can often be one of the first warning signs. According to the study, the itching is caused by an overactive immune response triggered by cancerous cells, which disrupt the normal functioning of the lymphatic system. As the cancer spreads, it causes inflammation in the skin, which manifests as an unrelenting itch, often in the lower legs, thighs, or feet. Take George, for example. He was 75 when he noticed an itch on his legs that wouldn't go away. For nearly 6 months, George simply applied lotion, thinking it was a harmless side effect of aging skin. But the itching persisted, and at night, it was unbearable. After visiting his doctor, he underwent a series of tests, which revealed an abnormality in his blood work and enlarged lymph nodes. He was diagnosed with Hodgkin's lymphoma, and the itch had been the first sign. This is a critical example of why unexplained persistent itching should not be ignored. If you experience itching that doesn't resolve with typical remedies, especially if it's on the lower legs and accompanied by other symptoms like night sweats, fatigue, or unexplained weight loss, it's time to speak with your doctor. Now, what can you do when you notice this? If you or someone you care about is experiencing a persistent itch in the lower legs that doesn't respond to lotion or moisturizers, especially if it worsens at night, schedule a visit to your healthcare provider. Make sure to mention the pattern of persistent itching and ask for blood tests or scans to rule out lymphoma or other cancers. Early detection of lymphoma can dramatically improve treatment outcomes. Don't wait for other symptoms to appear. Sometimes your body is trying to tell you something long before a diagnosis is made. Your skin can only communicate so much, but paying attention to these subtle signs can make a huge difference. Sign number 2, itching between the shoulder blades or upper back. It's a common experience for many older adults to feel a persistent itch between the shoulder blades or in the upper back, which they might attribute to dry skin, tight clothing, or poor posture. However, this specific and often localized itch can sometimes point to something much more serious: pancreatic cancer. It may sound strange, but this type of itch often appears months before more obvious symptoms like pain or digestive issues become apparent. And why does this happen? Pancreatic cancer affects the bile ducts, which are responsible for draining bile from the liver into the intestines. When a tumor obstructs these ducts, bile salts begin to accumulate in the bloodstream. One of the first effects of this accumulation is the irritation of nerve endings, particularly in the upper back. As a result, the upper back may become itchy, even though the skin itself shows no signs of irritation, redness, or rash. Scientific research published in the Journal of Clinical Gastroenterology points to a connection between biliary obstruction and itching, particularly in patients with pancreatic cancer. As the bile buildup increases, it leads to elevated levels of bile salts circulating in the blood, which can cause itching, known as pruritus, in various areas of the body, including the upper back. This symptom is often overlooked as simply a scratch or dry skin, but it can actually be an early sign of pancreatic cancer. In fact, a 2019 study found that persistent itching on the back was one of the earliest detectable signs in some pancreatic cancer patients, occurring even before significant digestive or pain symptoms. What to do? If you experience persistent itching in your upper back, especially if it feels like it's coming from inside rather than from the surface, don't dismiss it as just dry skin. Combined with other subtle symptoms like fatigue, pale stools, or darker urine, this type of itch warrants a visit to your doctor. Be sure to mention the persistence and the unique sensation of the itch, as it could point to an underlying issue with your pancreas. Early detection of pancreatic cancer significantly improves the chances of successful treatment and survival. Pay attention to the places your body is trying to tell you something. A persistent, unrelenting itch could be an early sign that you don't want to ignore. Stay proactive with your health and don't brush off the little signs. They might be the first step to catching something serious before it escalates. Sign number 3, itchy scalp without visible flakes or dandruff. An itchy scalp is a common issue that many people deal with, but when the itching becomes persistent and doesn't seem to respond to typical treatments like anti-dandruff shampoos, it could be a sign of something deeper, including blood-related cancers like leukemia or even skin cancer. Why this happens? Itching of the scalp without visible flakes or dandruff often occurs when the immune system is in overdrive, typically due to abnormal immune activity from certain types of cancer. For instance, blood cancers like leukemia can affect the way the body regulates inflammation, which often manifests as an itchy sensation in the scalp. Unlike typical dandruff, which usually shows up with flakiness, this kind of itch is usually accompanied by a burning or tingling feeling that moves around the scalp. The scalp, being densely covered with nerve endings, can be highly sensitive to these changes, making it an early warning signal when something's not quite right internally. For instance, Henry, 73, had been experiencing intermittent itching on his scalp for months. At first, he thought it was due to dry skin or maybe a reaction to a new shampoo, but even after changing products, the itching continued. It wasn't like the usual dryness he had experienced in the past. The sensation was odd, more like a tingling or crawling under the skin. After his wife encouraged him to visit the doctor for a full checkup, blood work revealed unusually high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. The itching on his scalp had been the first and only symptom of the disease. What to do? If you notice persistent itching on your scalp that doesn't respond to shampoo or moisturizing treatments, it's essential to bring it up with your healthcare provider, especially if you have other symptoms like unexplained fatigue or feeling off in a way you can't explain. While itchy scalp could simply be a dry skin issue, in older adults, it can sometimes signal underlying blood cancers, including leukemia. Don't let it go unchecked. Early diagnosis can lead to a more favorable treatment outcome. Pay attention to how your scalp feels and how persistent the irritation is. It could be more than just a harmless itch. It could be a message from your body, urging you to take action. Sign number 4, localized itching on the chest or breast area. Itchy skin around the chest or breast area, particularly near the nipple or underneath the breast, may seem like a minor annoyance. Many people, especially older adults, chalk it up to irritation from tight clothing, sweat, or age-related skin thinning. However, when the itch persists without relief and becomes a consistent problem, especially in the same area, it could be signaling something much more serious, like inflammatory breast cancer or other tumors near the chest wall. Why this happens? Inflammatory breast cancer, IBC, is a rare but aggressive form of cancer that can often begin with skin irritation or itching rather than the more typical lump. In IBC, cancer cells block the lymphatic vessels in the skin of the breast, causing the skin to thicken, become swollen, or feel itchy. The itchiness is a result of the inflammation and the body's immune response to the growing tumor even before any lumps are detectable. This condition can mimic common skin rashes or irritation, which is why it is often overlooked in its early stages. In other cases, itching in this area could be related to swelling of nearby lymph nodes due to other cancers like lymphoma, which also affects the chest region. The lymph nodes are part of the body's immune system, and when they become enlarged, they can cause discomfort and itching around the breast or chest area. A study published in the Journal of Clinical Oncology highlights that itching in the breast or chest area, along with other skin changes, such as thickening or redness, can be an early symptom of inflammatory breast cancer. This research points out that in many cases, the itch appears months before a lump is felt, which is why it's vital for individuals to pay attention to skin changes or persistent irritation in this area. The National Cancer Institute also recognizes persistent itching, along with skin changes, as an early sign of breast cancer. What to do? If you experience itching around the breast or chest area that doesn't respond to typical treatments like moisturizers or changing clothing, take it seriously, especially if the irritation is persistent and localized. Pay attention to any changes in the skin texture, like thickening, redness, or dimpling. If you also notice other symptoms such as swelling, pain, or lumps, see a doctor promptly. Remember, this is not about panicking. It's about awareness and acting early. For both men and women, noticing changes in the breast area and addressing them with a healthcare provider can make all the difference in early detection. Your health is worth paying attention to, and even seemingly small symptoms like an itch could be your body's way of giving you a crucial message. Sign number 5, persistent itching in the anal or genital area. Itchy sensations in the anal or genital region can be an uncomfortable and often embarrassing topic, but when persistent, this kind of itching can signal a much more serious underlying health issue. For older adults, persistent itching in these areas that doesn't go away with typical treatments or improvements in hygiene could indicate conditions like anal, vulvar, or penile cancer, all of which are unfortunately common in older adults, particularly those over the age of 60. And why does this happen? Persistent itching in the genital and anal areas may seem like a common issue caused by dryness, hemorrhoids, or skin irritation. However, when the itching doesn't resolve despite the use of creams or lifestyle adjustments, It can be an early symptom of more serious health problems, including cancers in these regions. Cancer cells in the anal, vulvar, or penile areas can cause localized irritation as the cancer grows and disrupts normal tissue function. This irritation often presents as an itching sensation that persists or intensifies over time. Anal cancer, for example, is more likely to develop in individuals with a history of human papillomavirus, HPV, infection, or weakened immune systems. Similarly, vulvar cancer, which is relatively rare but increasingly common after age 60, can present as itching or discomfort in the outer genital area. For men, penile cancer can cause similar symptoms, including itching or irritation of the skin. The challenge is that these cancers often don't show obvious lumps or abnormalities initially, making the subtle symptom of itching especially crucial for early detection. A study published in The Lancet Oncology reported that persistent itching in the anal or genital area should not be dismissed, especially in older adults. Research suggests that unexplained itching in these regions, particularly if accompanied by changes in skin texture, swelling, or the appearance of sores or lesions, should raise concern. The American Cancer Society also notes that chronic itching can be an early warning sign of anal or vulvar cancers, and that early diagnosis significantly improves treatment outcomes. Eugene, age 76, from Alabama, had been dealing with what he thought was hemorrhoid irritation for almost a year. He used creams, changed his diet, and even tried cold compresses, but the itching never fully went away. After finally undergoing an exam with a colorectal specialist, he discovered a small lesion on the anal canal wall. It turned out to be an early-stage tumor. Had he ignored this persistent symptom, the tumor would have continued to grow undetected, delaying necessary treatment. The key to his early detection was not dismissing the itch and following through with a doctor's visit. What to do? If you experience persistent itching in the anal or genital area that doesn't improve with standard treatments, it's important to seek medical advice. Don't dismiss the discomfort as a result of minor issues like dryness or irritation. If the itching is constant, worsens over time, or is accompanied by other symptoms such as swelling, skin changes, or pain, speak to your healthcare provider for further evaluation. Even though it might feel uncomfortable or awkward, bringing up these concerns could be the key to catching something serious early. Remember, addressing persistent itching early can make all the difference. It's not about avoiding an uncomfortable conversation, it's about taking control of your health. Don't wait until it's too late. Talk to your doctor and take the first step toward understanding what your body is trying to tell you. As we've explored today, the body has its way of signaling distress, often through subtle signs we might overlook. We've covered 5 key areas of the body where unexplained itching might be an early sign of something more serious. These areas are the lower legs. Persistent itching, especially on the shins and calves, could be linked to blood-related cancers like lymphoma. The upper back. An itch between the shoulder blades, often felt beneath the skin, may indicate pancreatic cancer, sometimes months before other symptoms appear. The scalp. An itchy scalp, particularly without dandruff or visible flaking, can be a sign of blood cancers like leukemia or even skin cancer. The chest or breast area, itchy skin around the chest, especially near the nipple or under the breast, could be a sign of inflammatory breast cancer or tumors. The genital or anal region, persistent itching here, despite normal hygiene and treatments, might point to cancers such as anal, vulvar, or penile cancer. Remember, these signs might seem small, but they could be your body's way of sending a message. Catching these symptoms early could make all the difference in your health outcome. These signals aren't something to ignore or downplay. Your body is speaking to you, and listening to those quiet whispers might save your life. If you notice any of these signs, whether it's persistent itching in any of these areas or changes that just don't feel quite right, It's essential to speak with your healthcare provider. Don't wait for something more serious to develop. Early detection is key, and getting ahead of potential health issues can give you the best chance at treatment and recovery. I'd love to hear from you. Leave a comment below if you've learned something new or have experienced one of these symptoms. Please like, share, and subscribe for more informative content to keep you healthy and informed. Thank you for watching, and we look forward to seeing you in our next video.